It's a gorgeous day out there. It is fantastic to see everyone's faces here. And I'm also excited for the folks that are joining us virtually this year. It is so good to be in a room with people who are about this work. I want y'all to take a moment, take many moments over the course of these next 2 days to spend time with folks who've been in it a while, who you know, to make some new friends, because the work we do on a day-to-day basis, it is hard. It's hard to keep up hope. It's hard to keep up energy, and you need allies in that fight, and those allies are in this room. We give each other energy. We give each other strength and hope to keep going in the face of some monumental challenges. My name is Samuel Gunter. I'm the executive director of the North Carolina Housing Coalition. There's going to be a moment at lunch where you'll get the normal welcomes from all the hosts of the conference. We didn't want to burden the morning with this because we are honored to have a couple of folks who want to say hi to you and talk to you a little bit about the landscape. And we didn't want to take away from that time right on the front end. So it is my honor to first introduce the new Secretary of North Carolina Department of Health and Human Services, Dr. Sangvi. He's going to say a word and then going to introduce the governor as well. Please join me in giving a warm welcome to Secretary Sangvi.
Thank you, Mr. Gunter. Good morning, everyone. Thank you to the North Carolina Coalition to End Homelessness and North Carolina Housing Coalition for hosting this meeting. Thank you also to the NCDHS team in planning this conference. I always like to start these meetings by asking anyone who's affiliated with North Carolina DHHS to raise your hands. Who do we have in the room today from the agency? I want you to take a look around. These are the people who are doing the important work at NCDHHS. I often say my role as secretary is really to only do two things. Don't put something in the way of people who want to get stuff done, and help remove things that are in the way of individuals who need to get stuff done. So thank you for the great work that you do. It's always good to be at the McKimmon Center as well. I love our public institutions, and I think it's always good to give a nod to say important meetings like this are taking places in the halls and buildings of our public institutions. I don't need to tell you that this is an important issue for all North Carolinians. So it's really an honor to join so many advocates, professionals, and policymakers committed to improving housing options and reducing homelessness in North Carolina. You know, the state has recognized this issue and dedicated significant funds, $15 million from the state fiscal recovery funds to help in this effort. We know that that's a drop in the bucket, but hopefully it's a signal on the important work that you're doing. And these funds were really used to address homelessness by supporting rapid rehousing and homelessness prevention programs. And we continue, and we aim to continue to work and dedicate the type of resources that we need to making homelessness brief and in fact rare. So as I said, this is an important topic, but to me, I'm a physician by training. And to me, so my daughter asked me today, they still ask me every day, what are you doing all dressed up? Because they're still kind of getting used to the fact that, that I'm in this new role. And so I told her I'm going to a conference on healthcare. And she's asked me, what are you going to be talking about? I'm going to be talking about housing and homelessness. And she said, I thought you were talking about healthcare. And what I said to her is housing is healthcare. If it's nothing, it is healthcare. You know, thank you. You know, we use words like availability, habitability, affordability. These sound like economic terms and housing terms, but to me, they're really part of the medical dictionary. For 20 years, I've been a part of the healthcare landscape here in North Carolina. And so I've had an opportunity to see face-to-face what really is impacting our citizens from a healthcare perspective. My most recent role was president of a hospital in the northern part of Durham County. And, you know, hospitals are unique because you really get to see all that there is in the human condition. I used to say that my father's a retired general surgeon, and he told me that hospitals are unique because in this building, you have people who are getting the best news of your life and the worst news of their life, oftentimes side by side. And so when I think about that other part of it, the worst news of their life, sometimes we would often see this in our emergency rooms. And I would see the realities of what happens when individuals are unhoused, nowhere to go, hungry, cold, tired, wet, and the only place to go is the emergency room. And so the work you're doing right now is about healthcare. It is absolutely about the health and wellness of the 11 million people who live in North Carolina. And why do I say 11 million people? Because you're going to hear a bunch of statistics. I may even share a little on how many people are impacted. This is everyone's problem. This is not the individuals who you can not make eye contact with when we're at that traffic light. We all know we do that, right? We just say, hey, you know what? If I can just get the light to turn green, maybe I can ignore the problem that's right outside my window. And so this is a healthcare issue. I also ran a hospice and home care program and case management program where I heard individuals say, I don't know if I can get care again because I don't know where I'm going to live. I don't know where I'm going to be. So as a practicing physician, I saw the impact of the services that North Carolina DHHS and Coalition and others were doing and how important it is. One of the other things that I've consistently endorsed is this idea that physical health and mental health are all part of the same thing. They're deeply interconnected. Whole person care has really guided my practice since I began my career decades ago. I know the importance of stable housing as an essential ingredient in supporting whole person care and stabilizing individuals in order to have them be successful. You all know this. Homelessness is on the rise in North Carolina. The number of people in North Carolina who are homeless on any given night increased by nearly 20% to almost 12,000 people from 2023 to 2024. You know, the other thing that I always kind of think about is when you are in charge of an agency the size of NCDHHS, we often will quote large numbers because we want to show the aggregate impact. But at the end of every one of those numbers is an individual. And so we're talking 12,000 individuals who, and I think that may be an underestimate. You know, and outside of the beginning of COVID, this is really the largest single year spike that we've seen in over a decade. So at the department, we have multiple programs that are helping people obtain stable housing. These services include homelessness outreach, transitional housing, community-based housing, providing financial assistance, making housing stable and accessible, and providing tenancy support to help people maintain their housing. We work with hundreds of partners, each and every one of you in the room, to deliver these services, including other state agencies, local governments, nonprofits, and other companies. It really is everybody's issue to address. And so all of you in the room and those of you online are absolutely essential to moving the agency's agenda forward. We know that the wait list for many of the services that we provide and that you provide is long. We know our inability to ensure stable housing for everyone is a challenge. It makes it harder for people to be physically and mentally healthy and how to live fulfilling lives. So in order to get closer to achieve that goal of people having access to safe, decent, affordable housing, some things we need to address are access to services and assistance in building the infrastructure of affording housable stock. You're going to hear a lot happening in the next couple of days and weeks about what's happening in the Medicaid program and in the SNAP program. And you might say, well, aren't we here to talk about housing today? The other thing I've learned in this job in 4 months is everything is connected. Behavioral health is connected to housing. Housing is connected to childcare. Childcare is connected to the economy. We do not have to artificially connect the dots to make a point. It is proven. There are data out there to support that. And so we really need to understand that if we don't address the homelessness issue and the housing crisis, it poses a direct threat to the stability and the economic well-being of North Carolina. So as Secretary, I'm committed to policies that help to help support the whole person health. Some of my priorities, building a sustainable workforce to support a healthier North Carolina. I also want to focus on strengthening access to care and housing in all North Carolina communities. We're also looking to make sure that we support a stable Medicaid program. As I mentioned, you're going to hear more and more about what's going to happen there based on actions happening both in the General Assembly and on the federal level. And we've got to make sure that our programs and services are working for all North Carolinians, especially those in vulnerable communities, and especially those who have challenge with finding housing. So I'm eager to listen to our key stakeholders, partners, people. We have a great team at DHHS that keeps me updated on all the priority issues. My goal is to make sure that we continue to collaborate, to get out of the way, to not put things in your way, to do all the important work that you do. So I'm excited to know that this conference is taking place. I think you're going to have a phenomenal 2 days of conversation to really figure out what we're going to do to not only solve the problem, but to be an exemplar for the entire country on what we can do for those individuals who are struggling with issues with housing and homelessness. So I look forward to working with the General Assembly, elected leaders, and again, you towards that goal. And so now the real reason you all are here, I'm like the opening act. If you go to a concert, nobody really pays to the opening, pays attention to the opening act. Everybody's getting their things, but we're also very fortunate to be joined this morning by Governor Josh Stein. North Carolina is so fortunate to have a leader with a shared mission to improve the health and well-being of everyone who calls this great state home. Since being sworn in office in January, Governor Stein has been focused on creating opportunity for all North Carolinians and ensuring a healthier North Carolina. I have to tell you, when I was interviewing for this job, I was scared, first of all, because I had never met a governor before, yet alone to be interviewed by a governor. And so, at the end of every interview, people ask, what questions do you have? And so in my mind, I'm saying, say something smart, Dev, say something smart, say something smart. And so I asked, I said, what's the Stein administration's view on health? And what the governor said to me was incredibly poignant, simple, and so pertinent for today. What he said is, Dev, I believe, my administration believes that everybody should be entitled to health, regardless of where you live or how much money you make. And so nothing can be more poignant, nothing can be more on point. So it is an absolute honor and privilege to introduce your governor, Governor Josh Stein.
My mother says that one thing I do well, how moms always bring you down, put you back on earth. She said, one thing you do is you always bring good people onto the team. And how about with Dev Sangvi as our DHHS secretary? When he said yes, I think I was the happiest man in North Carolina. So Dev, thank you for all you do. I'm pleased that Harry Miles, Field Director for HUD's Greensboro office, and Donald Whitehead Jr., who I know will be an impactful keynote speaker, are here today with us. And I want to thank the people who put this conference together: DHHS, the Coalition to End Homelessness, the Housing Coalition. They are bringing together advocates. I heard Sam's first comments about this is an opportunity for you all to interact, to exchange ideas, to gain friendships, to gain solidarity, gain support, find allies. This is a really wonderful opportunity for you, and I hope that you take advantage of it and that it is everything that you hope for. Conference comes at a critical time because homelessness is on the rise in North Carolina and across the country. In 2024, the point-in-time count found that more than 11,000 people were experiencing homelessness in our state, which is a 19% increase over the year before. Among the group, a number of folks who don't have shelter, who may have been on a park bench or a bus station, that number has increased even further. So too often people think about the issue of homelessness as a either or mindset. You either have a home or you don't. You're vulnerable to homelessness or you're not. You're to blame for being homeless or you're virtuous if you are not. That type of mindset is harmful to our ability to see people's humanity, just as it's harmful to our ability to effectively diagnose the problem that we need to fix. In our country, nearly half of Americans report living paycheck to paycheck, meaning that the simple act of losing a job could lead to homelessness. Report shows as many as 60 people experience homelessness actually do have a job. They simply cannot afford rent. We have to shift our thinking to recognize how many people are vulnerable to homelessness, to see that it could happen to our friends, our neighbors, people we work with, people we worship with. We need to let go of seeing anybody as less than. And then we allow ourselves to choose policy solutions that benefit all of us. I loved what Dev said, that this is a problem facing 11 million North Carolinians because it affects every one of us as a resident of the state. None of us benefit when people do not have a safe place to call home. People find themselves without housing for a variety of different reasons, but one key factor is that we do not have enough homes, and the homes we have cost too much. Report after report reveals that cost is a major cause of homelessness, a major barrier to when people are trying to return to housing. It makes sense intuitively, and it certainly gives us guidance on what we can do to address the problem. We have got to build more homes that are affordable and within people's reach. There's a saying that if you build it, people will come. Well, it turns out in North Carolina, if you don't build it, they will still come. We are the third fastest growing state in the country since the last census, trailing only Texas and Florida. We've got to increase the supply of homes to meet this newfound demand. Home is more than just a roof over one's head. It's also an anchor. It's a way to build family wealth. So we have to increase home ownership opportunities, expand housing options of all types across the state so that the home becomes a source of stability, not one of stress. My budget that I've shared with the General Assembly proposes $60 million to leverage public and private funds to build more affordable housing in North Carolina. Also, to incentivize local governments to update their zoning restrictions to enable the construction of more types of housing of all kinds. We can't invest in just one type of housing. Yes, we need single-family homes, but we also need duplexes, triplexes, quadplexes. We need townhomes. We need condominiums. We need apartments, and we need special needs housing because different types of housing meet the needs of different people in our communities. I know that the Department of Health and Human Services is emphasizing permanent supportive housing in its strategic housing plan, and I thank them for it. Permanent supportive housing has been successful in supporting people with disabilities, improving physical and mental health outcomes, and reducing hospitalization and homelessness. Housing is not a one-size-fits-all solution. Each puzzle piece helps us solve the broader problem. There have been a number of bills introduced this session at the General Assembly to cut red tape at the local level, which is inhibiting construction from happening around the state. Many creative solutions have been put forward, such as allowing developers to have the right to build new housing in any area zoned for commercial, retail, or office use, rather than having to get that property rezoned. They're thinking boldly about how we can increase housing supply, and this is certainly an issue where there is the possibility for bipartisan solutions. On the other hand, we are seeing efforts at the General Assembly to make sleeping in a park a crime. No one should have to sleep outside. It's a real problem, but we need to find real solutions by connecting people with supportive services and putting more roofs over more heads. In that same vein, I'm gravely concerned about federal efforts to eliminate Section 8 housing. More than 25,000 people in North Carolina depend on Section 8 to have a home. They can't afford to have that support taken away from them, and we cannot afford it either. Let's work to expand access to housing, not take it away. I'm similarly concerned. I am similarly concerned about federal proposals to cut Medicaid and SNAP benefits. These cuts pose a serious threat to the wallets and well-being of so many hardworking families here in North Carolina. Cuts to essential needs like healthcare and food make it that much harder for people to afford housing. And they'll make it even harder for our state to afford to support our people. If you agree with those points, please contact your congressperson, contact your U.S. senators. They are debating these issues today, and they need to hear from us. Housing is the biggest ingredient in the homelessness equation, but it is not the only one. We have to address the mental health needs of our people. In our state, 1 in 7 people experiencing homelessness have a serious mental illness. 10% suffer from chronic substance misuse. Just like no one chooses to have a physical illness like cancer, no one chooses to be mentally ill or to have substance use disorder. Too many people are not receiving the health care that they need. I'm very grateful that our First Lady, my wife, Anna Stein, has chosen making reducing stigma around mental health and substance use disorder one of her top priorities, and that she brings such a compassionate and evidence-based perspective to that work. We have to pursue evidence-based solutions for helping people heal from substance use disorder, things like medication-assisted therapies. As Attorney General, I help to lead the nation in the bipartisan effort of state attorneys general to hold accountable the big drug companies that created and fueled the opioid crisis to the tune of $55 billion, our state share being $1.5 billion. And nearly every one of those $1.5 billion are going to help people who are struggling with addiction overcome that addiction so they can live a happier and healthier life. Programs like medication-assisted therapies, they save lives, help people get off the streets and on their feet. Let's commit ourselves to reducing stigma and getting people on the path to recovery. As we work to support those who are struggling, we must also remember that we have a duty to take care of those who served our country, our veterans who disproportionately face homelessness. Just like for the broader homeless population, we have to address the web of challenges that veterans face, whether it's dealing with mental illness, substance misuse, or PTSD, finding a good paying job, or finding an affordable and safe place to live. I know that our Secretary of Department of Military and Veterans Affairs, Secretary Jocelyn Millett, is dedicated to tackling this issue, and the DMVA has a network of partners across the state who are similarly working to find shelter for our vets. We have to ensure that shelter is accessible and that our veterans have the resources that they have earned so that no veteran is without a place to call home. When we're tackling a problem like homelessness that involves so many interlocking parts, we need a coordinated solution that includes every partner necessary and every tool in the toolbox. That's why a continuum of care model is so important, one that brings all the players to the table and ensures that folks can get the help with no matter what needs they have when they show up. People need permanent supportive housing, rapid rehousing, transitional housing, supportive services. These services may support somebody who's experiencing homelessness, or they may prevent someone from becoming homeless. Either way, by using a one-stop shop model, we make it easier for people to ask for and receive the specific help that they need. I'm very proud to continue Governor Roy Cooper's work with the North Carolina Interagency Council for coordinating homelessness programs. The council is focused on how we expand access to rental assistance, access to rental units, access to support services. As we pursue these goals statewide, we also have to keep our eye on the special needs that exist out in Western North Carolina after Hurricane Helene's devastation. In an area that was already experiencing a shortage of housing, Hurricane Helene damaged or destroyed 73,000 housing units. Just think about that. Currently, more than 5,000 families are receiving some kind of temporary housing assistance, including hotels, temporary trailers, or rental assistance. In my first budget to the General Assembly that I requested, I asked for $263 million from the legislature for housing, including home reconstruction and repair, affordable multifamily housing, rental, mortgage, and utility assistance, and housing stabilization services. I was gratified that the legislature did appropriate $120 million so that we could get onto the work of helping fix people's homes so they can move back into their own place. But it is nowhere near enough. We're also working to unlock $1.4 billion from HUD that we can jumpstart rebuilding permanent housing. We've gotten our action plan approved. We submitted our action plan faster than any other state impacted by Hurricane Helene. In fact, no state in the last decade that experienced a major hurricane submitted its action plan faster than did North Carolina. And we've already had that plan approved, and now we're negotiating the grant agreement. We want to get the dollars to North Carolina so we can get people in homes this summer and fall. In my second Helene request of the General Assembly, which I will soon be submitting, I will ask them to invest in homelessness prevention, affordable housing, rental, mortgage, and utility assistance. Again, if these are values or programs that you agree with, please contact your General Assembly members, State Senate and State House, to urge them to include this in the next round of Helene funding. It's pretty basic. If people don't have a place to live out west, they will not stay there. Housing is foundational to the recovery of the western region of North Carolina. Each of us has a role to play in reducing homelessness in our state, both preventing people from becoming homeless and helping them return to stability. So many people in this room are doing such critical work in your communities to address this problem. I am so incredibly grateful to you for what you do. And what I look forward to is partnering with you in the months and years to come, God willing, where we build a state that is safer, stronger, and more prosperous with real opportunity for every North Carolinian. Thank you so much for having me this morning.
What a powerful message. I don't know how I was selected to follow Governor Stein. This was not my idea, but I am delighted this morning as the director of NCCEH to introduce to you our keynote speaker for this morning. Our keynote speaker, Donald H. Whitehead Jr., is a native Ohioan, a retired veteran from the U.S. Navy, and someone who has incredible experience, not only in experiencing what the trauma of homelessness, being unsheltered, but also what it means to rebuild not only his own life, but to help rebuild the lives of others. He currently serves as the executive director of the National Coalition for the Homeless, and he is here for 2 days with us. He'll do this keynote address, and he is also doing a workshop for people with lived experience. We chose Donald Whitehead Jr. for this keynote address because of his depth of experience and perspective. Having lived along the continuum that we are talking about and discerning this week, we thought of no better person who could help us to understand, challenge us to think more creatively, and then help us to enact the things that we imagine. So this morning, please join me in celebrating and welcoming Donald Whitehead Jr., our keynote speaker. Thank you.
Good morning. One more time, good morning. It is so awesome to be here. As the secretary said, it's often a challenge to follow someone as magnificent as your governor, but I'll do my best to be able to share with you information and inspiration, hopefully that you can take with you. I have to say, though, it's just amazing that the North Carolina Coalition for the Homeless and the North Carolina Housing Coalition is able to have a governor come in front of an audience and talk about homelessness with the depth of understanding that you just heard. We have a lot of governors across this country who would not have any idea what homeless prevention or permanent supportive housing or criminalization means. So you are absolutely lucky to have someone with not only the depth of knowledge, but the conviction to be able to carry on programs that absolutely help people in this country and in the state. So I really am so grateful to hear that. I just had to interview about another progressive governor who thinks that criminalization is the answer. Yesterday, I had to interview about Governor Gavin Newsom in California, who has a very different approach to ending homelessness. So again, you're very lucky. I am truly grateful to be here with you today. And I thank you for demonstrating your care for my brothers and sisters who are experiencing homelessness. Homelessness is a solvable issue, but the homeless service sector and the advocacy community need your help in solving it.
And by being here today, you demonstrate your willingness to help. I love North Carolina. I haven't been here for a while. I delivered the keynote at this conference back in the early 2000s, actually 3 separate times. And last year I was here. I actually visited a veterans program, an amazing program down in Nashville, only to see that program devastated by Helene. It was actually leveled. And I do one thing about that program. It was a program where the community came together to care for and advance the situation for people experiencing homelessness, specifically veterans. About 350 veterans were served. But again, it was leveled by Helene. But I see the same community coming together to actually rebuild that particular program. And ironically, those two things are applicable to my message today. We are in disastrous conditions in the homeless community across this country. And it is so important that we rebuild it, and we must do that in collaboration. So I'm just going to give you a few statistics. First of all, last year, we had the highest number of people experiencing homelessness in the history of our country, at least since it's been measured by Congress, which goes back to 2007. Over 770,000 people, and that's 23 out of every 10,000 people in this country experienced homelessness. And that was an increase of 18%. Last year, it increased by 12%. So over the last 2 years, a 30% increase in the number of people experiencing homelessness. People and families saw the largest growth. There was a 39% increase in families experiencing homelessness across this country. And I'll save these slides for you later so you can look at them in more detail, because I'll be moving really quickly. And approximately 5 individuals experiencing homelessness on any given night were 55 years of age and over. And actually, the majority of the people living outside in this country are 55 and over. So that is our seniors who are experiencing homelessness at a much higher level. We also saw the continued overrepresentation of people of color. People of color make up 12% of the population in general, but almost 40% of the homeless population. We saw significant growth in the Latinx and Hispanic population. We saw growth in the Asian population. So people of color are increasingly more involved in the homeless population and included in the homeless population. So you see the numbers over the last few years, dating back again to 2007, and you see the dramatic increases that we've seen over that period of time. Now, if you look at students experiencing homelessness, there's a different definition. One of the challenges we have is that different departments within the federal government have different definitions. So the Department of Education counts people doubled up. So that point in time count we know is an undercount. So much so that the Department of Education in 2002 and 2022 and 2023 counted 1.37 million children in the school system in the United States experiencing homelessness. So if you think about that number, you think about most of them have a parent, many of them have siblings. The number is astronomical. And one of the reasons that we see homelessness increasing, the number one reason is that the rent is too high. We have seen a up to 30% increase in housing cost across the country over the last 2 years. Housing affordability is scarce. The National Low-Income Housing Coalition reports that about 7.3 million units is the gap in housing in the United States. So a little bit about the National Coalition. I'm going to jump to that really quickly. We are a national network of people experiencing homelessness, providers, advocates. We are the oldest advocacy group that works on behalf of people experiencing homelessness in America. And if you receive funding through the McKinney-Vento Act, we drafted the McKinney-Vento Act. It actually was originally called the Homeless Person Survival Act. It was a full set of resources to address homelessness. It would have ended homelessness if it would have been enacted as the Homeless Person Survival Act. Unfortunately, got whittled down and finally got introduced by Congress in 1987. And it is still the primary source of funding for homeless programs across this country. 1987 was when we enacted it, when we got it passed. It is still the primary source of funding. We've had 4 periods of homelessness in our country, dating back to the very beginning of this country. This period of homelessness is the longest in history. It dates back to the late 70s and continues today. So the National Coalition also passed the Education for Homeless Children and Youth Act. We drafted that as well. So every school district in the entire United States has a liaison to help school children. That is, again, the legacy of the National Coalition for the Homeless. Here is, I went a little too fast there. As the governor said, there is about 11,000 people or so in North Carolina that experience homelessness. Those are state level numbers. You can see other states as well. And those that are unsheltered across the country, you can see those numbers are very high in North Carolina, along with other parts of the country. And this is a slide that was produced by the National Alliance to End Homelessness. And this is how many people are at risk of homelessness if Congress goes down the path it's going now. So you see that the number last year through the point in time was about 11,000. What they're estimating is that there could be as many as 220,000 people experiencing homelessness. Those are how many people are at risk with the current situation that we have as far as legislation that is being proposed in Congress. So these are some statistics about how many people are in those different categories of extremely low, very low, and middle income, and where the gap in housing actually is. And you see that the place where there is the largest gap is for extremely low income renters. So there is no gap when you go up the line in income in this country. Here is another slide from our friends at the National Low Income Housing Coalition. It's from their Out of Reach report, and it looks at what it actually cost to be able to afford housing at 30% of your income, which is what the federal government says you should pay for your housing. So the housing wage in North Carolina is $25.21. So that's what you should be earning if you are able to afford housing at a housing level that does not make you rent burdened. If you're working a minimum wage job, you see you have to work multiple jobs. There is nowhere in this country where if you need a 2-bedroom unit, if you're in a family, that you can afford a place to live only paying 30% of your income if you work a minimum wage job. We know that minimum wage is $7.25 an hour in this country, and it takes about $25 in North Carolina and over $20 nationally. Only about 10% of the country can even afford a 1-bedroom. So the issue that people are facing is not their morality. It's not about their drug addiction or their mental health issues. It's the lack of affordable housing. That is the #1 cause of homelessness in America. The next biggest cause is poverty. And so what can we do to help? There's a lot of things that you can do. So we work in several areas. We work on policy. We work on organizing. We work on education. Those are some of the things that we're doing right now. I want to just a couple of things I want to share with you. This is a research study that was done by the Housing Narrative Lab. And what they looked at is who is with us in terms of homelessness, how many people care about the issue enough to do something about it. That number, the like-minded people, about 29% of the population. Then there's people that are opposed to homelessness, and that's about 22% of the population. But the largest number are those in the middle, and those are the persuadables. Those are people that we can persuade that we have the opportunity to change minds about homelessness. And so I think it's very important that as we think about the work we're doing, we think about how we can do it better. It's to figure out a way to get to those persuadables. And these are our 10, this is our 10-point legislative template. It is on our website. What we've really targeted is local community advocacy. And these are 10 things. I'm not going to go through all 10, but these are 10 things that we think can be done in local communities. We talk about housing often, and we talk about the need to produce units, but we should also talk about the thousands, tens of thousands of units that are abandoned in this country that can be converted to affordable housing through adaptive reuse. There's a lot of communities doing that around the country. The governor talked about homeless prevention. One of the slides that I didn't bring was about how many people, about 19% of the people, I believe, are homeless for the first time in our country. So this isn't people that are chronically homeless. The same number of people are actually homeless for the first time in our country. So these are some slides about the National Coalition and what we do, but I also want to talk about what's being proposed, because one program I do want to highlight is our Lived Experience Training Academy. We believe that the answer to homelessness is through building leadership among those who experience homelessness. The Lived Experience Training Academy, or LEADA, as we affectionately call it, is a program that trains people with lived experience to become a part of the planning processes in communities, to become staff at organizations, to help to rebuild what we've lost in this country. So I want to talk about also just what we're seeing in terms of legislation. I won't stay on that for a long time, but you heard the governor talk a little bit about it. I'm going to go into a little bit more detail. So these won't be on your slide, but what's being proposed right now is pretty grim. So there is, the president's budget would slash about $26 billion from HUD rental assistance programs. That's the Housing Choice Voucher Program, the Public Housing Program, the Project-Based Rental Assistance Program, Section 202, and Section 811 programs. He would combine them into a block grant into one program, and it would be a state rental assistance program. So taking away some of the local ability to manage those programs and moving them into a state block grant. There'd be a 43% cut to rental assistance, and there would also be a 2-year limit on rental assistance programs. So if you know of someone who is in one of those programs, that time limit would be reduced to a 2-year time limit. In his budget, he also talks about a $432 million cut in homeless assistance grants, the Continuum of Care program, the HOPWA program, all of them would be moved to the Emergency Solutions Grant. So they would be moved out of homeless assistance. They would be consolidated into the homeless emergency solutions grants. There'd also be cuts to many other programs, but it would in effect eliminate permanent supportive housing. Now we hope that there'll be a intervention by sound minds in Congress. There's also a proposed 50% cut to HUD staffing overall, and a 80% cut to the staffing for the CPD program, the Community Development Program, which oversees all homeless programs. So what that budget is called the President's Skinny Budget. So it doesn't have all the detail in it. It still has to go through the Senate and the House. And we're hoping that, again, there's some sound minds that intervene. But if that budget goes through, it would be a devastating impact on people experiencing homelessness. And I don't know who you voted for, but I don't think you voted for an 80% reduction in HUD staff or $1 trillion worth of cuts between Medicaid and the SNAPS program. I don't think that's what you voted for. And all of that in order to be able to enact a $45 trillion tax cut, which benefits people at the top of the economic ladder mostly. And I also know you're doing a lot in your community, but I'm going to ask you today, we have to do a little bit more. We need your services. We need that people experiencing homelessness need your service. But what we truly need is justice. Housing should be a right in this country for every single person. We deserve a country that values housing. At the very beginning of our country, we were promised life, liberty, and the pursuit of happiness in the preamble to the Constitution. And I have to say today, you can't pursue happiness sleeping under a bridge. There is no liberty when you are fined, jailed, or ticketed because you can't afford a place to live. You cannot pursue happiness if you lay your head in the back of an automobile. Would you be surprised to know that last year the Supreme Court decided that it was illegal to criminalize homelessness in the richest country in the history of the world? And since that time, 170 communities have decided that instead of housing people, will fine, jail, or ticket them. And that is what's happening across this country. It is unconscionable that in this country, that is our solution to homelessness. They did a study a few years ago in Osceola, Florida. What they found is that a community had arrested 30 homeless people 1,237 times. That accounted for $6 million wasted, because as we know, if you jail, fine, or arrest somebody, it does not solve homelessness. Criminalization is not the solution, but those are local decisions. And the only way we can have an impact on those local solutions, those local issues, is that we have to be advocates in our community beyond the service. So today I'm asking you to do more. Don't just show up for work. I know this is hard. I know it's frustrating. I know there's uncertainty in the air, but we need you to contact your legislators today. So I'm asking you today, before you leave this Congress, call your representative in Washington, in the State House. Make sure that North Carolina doesn't become included in those communities that are criminalizing homelessness. There's a bill, you heard the governor say that. There's a bill right now that would criminalize homelessness in the state. Do not let that pass. And you have the power to do that. Every person in this room has one thing that they can use to change this world, and that is their sphere of influence. We have had so many times in this country where we've been able to defeat the most draconian of issues, from slavery to women's rights, to the right to vote in this country. We came together, we saw a problem, and we fixed it. And we can only do that if we come together and we become dissatisfied with walking past people, walking over people, viewing people in abandoned cars. We cannot stand for that. We must be dissatisfied. And I'm going to share with you a quote from Dr. Martin Luther King where he talks about becoming dissatisfied. What he says is that we must become dissatisfied. Let us be dissatisfied until America will no longer have a high blood pressure of creeds and an anemia of deeds. Let us be dissatisfied until the tragic walls that separate the outer city of wealth and comfort and the inner city of poverty and despair shall be crushed by the battering rams of the forces of justice. Let us be dissatisfied until those that live on the outskirts of hope are brought into the metropolis of daily security. And let us be dissatisfied until the junk heaps of poverty, the slums, are cast into the junk heaps of history, and every family is living in a decent sanitary home. Martin Luther King. And where do we go from here? And we must answer that question, where do we go from here? And I want to say this really quickly before I close and open to question and answer, that what I present to you today are words and statistics, but also symbolize something that I hope all of you understand is that homelessness is solvable. I am a person, often you come into a room like this and you have hopes and aspirations about the people you serve. You believe that people can make it through. And today you see tangible evidence. I am the evidence of the work you do having a positive outcome. I have had the opportunity to be in 8 movies. I've won an Emmy. I've gotten to speak at the United Nations. I've met with 4 presidents. But before that, I laid on a mat in a shelter, wondering why I was most likely to succeed, and I had succeeded in ending up in that shelter. But today, I'm your tangible evidence that homelessness is solvable. And I want to share with you, my mother passed last year. Mother's Day was really hard for me, but I remember what my mother said, and I'm going to ask you to do that today. She asked me to be somebody. And she said that all the time, and I always thought she wanted me to be famous or be some kind of superstar. But that's not what she meant. She wanted me to be somebody, and I want you to be somebody. But what she meant by being somebody is that we're always saying that somebody needs to do something. Somebody needs to make change, and you can be that somebody. So as Mama Whitehead said, be somebody. And if you haven't had the opportunity to make change yet, you can still do that. And I am so grateful for being here, and I consider myself a success, but not a success in any definition that we usually use. I believe that I'm a success because success should be Booker T. Washington's definition of success. Success should not be judged by one's station in life, but the obstacles they had to overcome to get there. And again, I thank you so much for being here today. And I am open for a couple of minutes for any questions you may have. I thank you so much, but we need you. We need you in this fight 100%. Please don't leave today without calling your representative, either at the state level, the city level, or the federal level. We need them to actually have some wisdom, have some compassion, and stop hurting the elderly and children, because that's what's on the table. The issues that would hurt children and would hurt our elderly. What kind of society is that? So I thank you very much, and thank you for being here. And I really appreciate Dr. Asgard and the rest of the team for allowing me to be here. Please join us in the fight. Thank you very much. So I'm happy to answer questions for about 5 minutes. Okay.
Hi. As we connect our communities in places like lived experience groups, how do we get them connected to your Lived Experience Academy?
So if you go to our website, www.nationalhomeless.org, I'm going to get that for you. 124. So there is, if you go to our website, there is a sign-on for the Lived Experience Training Academy. One thing I didn't mention about the academy is that once you complete it, and the typical time is 16 hours, you do receive a $150 stipend as well. So, so explain a little bit more. You said you're having trouble breaking barriers with mental health issues.
So we've got mental health issues that we're trying to break the barriers on. some of the facilities that we're working with are not wanting to accept patients. They're obviously in need of mental health care crisis intervention, but we can't get the barriers broken. How do we go about doing that?
That is a question that I think has to be answered locally. Unfortunately, we believe in the idea of low barrier shelter. So we take people, what we promote is people being able to enter a shelter as they come. We are working on shelter standards to make sure that if people are getting federal dollars to operate shelters, there are some standards. And one of those would be that they accept people regardless of their condition. So if they have mental health or substance abuse issues, if they're in the LGBTQIA population, that they're still allowed to be in shelter. So we are working on both shelter standards and also reimagining shelter. We do believe that non-congregate shelters are the way to go. I think the Department of Health and Human Services may be a way to get around that. And I would direct you to the coalition so they can direct you in places that may have a better handle on those. There are definitely programs that exist, but I couldn't tell you exactly who they are in North Carolina. All right. Well, I think we can go ahead and end. Again, thank you very much. And my personal email is there. Happy if people want to ask questions, and I will make the slides available for anybody who wants to have them. So thank you again for being here. Have a wonderful day.